So what conditions can cause extreme period pain or heavy bleeding? We just said that.
We just said it, yeah. But we get probably the one thing, just because not everyone knows what endometriosis is, but people hear the word endometriosis.
Yeah, what is that?
And so maybe just to differentiate two of the more common causes. So endometriosis is from the word the endometrium, which is a lining of the uterus. And that's what grows every month and gets stimulated by hormones to get ready to like have implantation for a pregnancy. When you're not pregnant, the hormones have a switch that flips and you have your period. That lining of the uterus, when it gets outside of the uterus, it can have implants on the ovary, the bowel, the bladder, the pelvic sidewall. Weird things can happen. It can be in your lung tissue. It can be, if you've had surgery, dragged up through the skin. And so people will have pain during their menstrual cycle, like either before or during their cycle, because that tissue will get stimulated by hormones.
Hi, friends. Welcome back to We Time Convo. I'm your host, Debbie.
And I'm the co-host, Liza. Today's episode, just a casual convo about excruciating pain, blood loss, emotional chaos, and the miracle of womanhood, otherwise known as debilitating periods.
Back with us is our brilliant OBGYN, Dr. Bovone, who actually knows what an uterus looks like on the inside. Spoiler, it's not cute when angry. And hold it down with the science and sass. We've got physics teacher Marita.
Hello.
Who will remind us that even Isaac Newton couldn't explain PMS.
Good morning, everybody. Marita, long time no see.
Hi, Liza.
Suzanne, or Dr. Bovone.
Yes.
Welcome back. Long time no see.
Thank you for having me.
Yeah, how have you been?
I've been great. Just busy at work, taking care of the
Looking
kids.
at vaginas.
That's what I do.
Yeah, nice. Very exciting. So let's get into it. We are going to talk about, of course, Dr. Bovone is here. So what else are we going to talk about?
Hoo-has.
Yeah. Hoo-has, vaginas, whatever you want to call it. And just all things, literally like painful, right? All things that associate with the vagina or the inner lady
uterus.
Part. Uterus.
Like the technical term.
The pain is the uterus, not the vagina.
You know what we were just talking about yesterday? I was talking to my coworkers about, because her daughter had just started her period. So we were talking about like tampons and all that stuff. And I was like, you know what? I didn't even know there was a separate pee hole until maybe like 10 years ago.
Oh my gosh.
And I found out because Dawn Marie, she's a our PE teacher. She had me make photocopies of like the coloring pages that they do. Yeah. And I was looking at it and I'm like, where are so many holes? And I was like,
are you kidding me?
There's one where the baby comes out and one where the pee comes out.
I would say it's common. Like people don't know. And then sometimes I want to show people, I'll be like, do you want to look with the mirror? This just happened yesterday. And she's like, no, I'm not going to look again. So don't show me. Like, just don't show me. You look. That's your job.
I thought it all just came out of the same hole.
No, it doesn't.
Well, it doesn't.
So the more you know. So
the more you grow.
Yeah. Anyways, we are talking about the subject, and on topic, I actually have a friend who's actually recovering from surgery because she was having debilitating periods. So bad that she said that she was like constantly like throwing up.
Yes.
Really, really, really bad. And when she went to the doctor, they found out that she had a very like enlarged uterus. And so they had to remove it. And she's so much better now.
Yep.
And
that happens.
Yeah. And she's like maybe in her late 30s.
That's like early to have
that. Yeah, it's early. Yeah. She's recovering well. But yeah, we thought maybe we should talk about this. Get Dr. Bovone on. She would know more.
Well, what's interesting is I think a lot of times women just live with pain because they believe that it's just a normal thing to have 100%. As a woman.
Yeah.
And so to me, it would be really interesting to like really understand, like, when do you know you should see a doctor?
I think if it's impacting your life, I think when like with our teens and young adults, older women, if the pain is affecting just your daily activities, going to work, living your life, being with the people you like, then definitely to come in. But you're right. A lot of people just talk about, or they don't talk about it. So they just assume cramps with your period are normal or heavy bleeding is normal, because women aren't sitting around saying, I change my pad or tampon every hour, or I am flooding and needing to carry extra clothes, or I'm staying home from work. Like people don't talk about it. So when they come to see us, we get into the details of like, How often is your period? How many days does it last? What products are you using? How often do you change them? Do you have cramps? Do you have clots? All of these things. And it's funny because when men are accompanying their partners, sometimes they're just looking at us like, what are you talking about? Like when you talk about like all the things that happen, because I don't think they realize it.
I fucking hate that
either.
Yeah.
I
just fucking hate it when they're like, "Oh, suck it up," and I'm like, "No,
no."
Uterus?
So no, and you got to remember that I feel like, well, my own personal experience is that my periods were not as painful as a teenager as they were towards the end of my menstrual. When because I'm already post that.
Same. I was just gonna mention that.
Yeah.
Like I've never had like debilitating like cramps, like doubled over or anything until like my late 40s.
Yeah. Or heavy
40s.
flow. So the last 5 years of me having my period, I would first of all, I have a friend who would describe it like, it's like a bloody murder scene because I'm like, what the heck? And then the worst part is like, I'd be in the middle of teaching and it's like it stopped me in exactly what I was doing. Like cramp, like I was holding on to my countertop and like trying to like maintain my composure, but it was so painful. I never experienced really painful cramps until then. So it's like, because I remember as a teenager, some of my friends would be like, "I'm not going to school today." I'm like, "Why?" And I got my period. I go, "Why? It's just your period." Because I was very athletic, and so I hear if the more exercise you do, it can alleviate some of that cramping and that kind of stuff. So.
Yeah. Dr. Bovone, so what exactly qualifies as a debilitating period?
So usually with painful periods, it's called dysmenorrhea is like the medical term. And so there's that, we call it like primary dysmenorrhea, which is just painful uterine cramping before or during the period, but there's no other underlying cause. Versus secondary dysmenorrhea is due to a disease process. Like your friend may have had endometriosis, adenomyosis, fibroids, an ovarian cyst, an infection. All of these things can cause painful periods. So when you come in to the gynecologist, we need to figure out like what is going on. And especially like midlife, perimenopause, definitely periods can get flooding, really heavy, irregular. And we are usually starting with some hormonal evaluation of like thyroid disease and then getting an ultrasound just to make sure we're not missing something. And then once we have all of our information, we can tackle like what to do about it.
Interesting. So what conditions can cause extreme period pain or heavy bleeding? We just said that.
We just said it. Yeah. But we get probably the one thing just because not everyone knows what endometriosis is, but people hear the word endometriosis.
Yeah, what is that?
And so maybe just to differentiate two of the more common causes. So endometriosis is from the word the endometrium, which is a lining of the uterus. And that's what grows every month and gets stimulated by hormones to get ready to like have implantation for a pregnancy. When you're not pregnant, the hormones have a switch that flips and you have your period. That lining of the uterus, when it gets outside of the uterus, it can have implants on the ovary, the bowel, the bladder, the pelvic sidewall. Weird things can happen. It can be in your lung tissue. It can be, if you've had surgery, dragged up through the skin. And so people will have pain during their menstrual cycle, like either before or during their cycle, because that tissue will get stimulated by hormones. And so one of the things that we look for is like, if you have that cyclic pain, it might be endometriosis. The gold standard of diagnosing it would be with a diagnostic laparoscopy. So a surgery where we're putting a camera into your belly and we see the implants, take a biopsy. You can kind of clean up all of those implants and hopefully their pain improves. And that can cause very severe pain. And it can take years to get a diagnosis because either people are, said, "Oh, just deal with it. It's normal. Everyone has it." Or they've kind of failed other like medical management things to help their pain. Versus adenomyosis is another common process where, again, with the lining of the uterus, the endometrium, it's growing into the muscle of the uterus. And so that causes the uterus to be bulky and you can have really painful, heavy cramps. Ultrasound findings may suggest adenomyosis and MRI as well. But again, truly like the pathology would be on a hysterectomy specimen. So when you take it out, the pathologist is saying, yes, there's endometrial glands within the muscle of the uterus. And so I usually pull up images online in the office to show patients just like more like cartoon type drawings, of here's where the glands are, and they kind of can see better like what's happening, just to differentiate the two processes.
Yeah. And so in me and like Marita's case, why would we experience a lot of like cramping and excessive bleeding in our age? Does that have anything to do with menopause, perimenopause?
It's very typical in perimenopause for your periods they can space out, they can get closer together, they can be lighter, they can be heavier. And so those are just with like probably huge, wide hormonal fluctuations. But you do want to make sure you're not missing something. So if you're having, like new onset, severe pain affecting your quality of life, like if Marita is having to like leave work, she's doubled over in pain, is there an ovarian cyst? Do you have an IUD that's malpositioned, any type of infection, fibroids, endometriosis, adenomyosis? So you still want to get evaluated. And then if everything's negative, then we'll kind of manage it either, with medical management of anti-inflammatories, perhaps hormonal management with birth control pills. Yeah.
So here's where I want to chime in. I feel like what Debbie said, you guys said earlier, like we just grin and bear it, so to speak, because like that whole time I was going through, when I first mentioned it to my doctor, and he said, you're a little young to be going through menopause. And so I'm like, okay, well then maybe this is just what it is. And I just grin. Yeah. And so like, I basically went through menopause, all that whole thing without seeing a doctor ever.
Because how old were you when it happened?
I was like in my early to mid 40s. It was like 44, 45. Mm-hmm. And I told my doctor that, I'm like, it's weird. My periods are being erratic. I'm feeling hot. I'm having all the hot flashes and stuff. And I don't remember who my OB was at the time, but they were just like, well, you're a little young for that. So then COVID happened, right? Mm-hmm. So like I was I remember talking to another school mom, and that's the one who said it was like a murder scene. I go, I know, I don't understand what's going on, So I just went through it. And then next thing you know, I'm like, oh, I just realized like, I'm not having my periods anymore. Mm-hmm. So like if my doctor would ask me, when was your last period? I'm like, I have no idea.
Yeah. So sorry that happened to you. We do know menopause, average age of not having a period for a year is 51, 52. But in the range for that happening is 45 to 55. But the perimenopausal time can be 5 to 10 years before. So any woman coming in their mid 40s, they're in perimenopause, probably just by age alone. And so a lot of women are coming in now, I think, with this like explosion of social media over perimenopause and menopause, and they want to come in and get their hormones checked. Everyone wants their hormones checked. And I usually say, we don't need to check your hormones. And we have a conversation of what perimenopause is, what their age is. The one hormone we will check always is thyroid, because as we age, we tend to have more thyroid issues. And there are more and more indicators that for some women, maybe those perimenopausal symptoms, it starts in their late 30s. So I think we can't dismiss women we have to listen. And if you're having painful periods or flooding periods, we shouldn't dismiss it. We should talk about it and say, yes, this can be, especially in your mid 40s, I would say 100%, this is perimenopause. Now let's have a conversation about it.
So, we keep hearing like the cramping the pain is normal. And what I'm hearing from you is actually it's not necessarily normal. That's just telling you go get checked.
Well, it can be just the cramps are caused by these increase in prostaglandins, which the uterine muscle will respond by like contracting. And then similarly in our bodies, increase in prostaglandins will also stimulate the bowel. So some people have diarrhea, loose stools, they may get nausea. So all of these things are linked together. And one of the methods of treating it is usually like non-inflammatory medications like Motrin, which will tamper down the prostaglandins. And so usually I'll always ask, are you taking anything and does it help? And some people they're trying Motrin, but maybe not at a high enough dose. Or we want to try different ones to see if that helps. But the cramping, it can be normal. But again, if it's interfering with your life, if it's something new, we don't want to ignore it because there's something else going on. We don't want to miss something. Yeah. So we will not only dive deep into like periods, like flow and duration, but we ask about any new sexual partners. What are your gastrointestinal issues? How are your bowel movements? And then we're also looking at How is sleep? How are stress levels? What is your diet like? All of these things are intertwined, and it takes time to talk with the patient to try to like see if there's anything else. Oftentimes I'll tell them to keep, a diary of when you're having the pain and like, what have you been eating? How's your sleep, your stress, your exercise? Because they may come to me and we're not finding a reason per se. And I'll say, let's go see gastroenterology if we can't find a reason. But the more information you bring to physicians, I think it helps us.
Yeah. In my case, and I texted you about this. So I noticed that when I was running, like I was having pain on my lower left side. But I was like, it's probably just pain, whatever. I actually went to a routine visit to see my OBGYN because I'm very like religious about seeing her every year. And she's like, she did a vaginal ultrasound because I have an IUD. She's like, let's check to see if it's still there. And it was, thank goodness, it was still there. She did find some eggs though. She's like, you still have eggs. And I was like, oh, okay.
We have little follicles. Yeah, you will have follicles still.
I didn't think I'd have any, but I guess I can get
They may not be like healthy.
But she actually by chance found a cyst that was 5 centimeters right there. And she's like, did you not feel it? I said, I did notice it when I was running. And she's like, well, we're not going to run for 2 months because we're going to monitor it. And she said, no running. I can't do cartwheels. I can't get on a trampoline. I can't have rough sex. And I'm like, okay, so if I can't do that, what the hell am I going to do? Like, what am I going to do for fun? So I was
Netflix.
Watch Netflix. Because
chill.
Yeah. So the reason why is just for...
Well, because if I do all that, Suzanne, you said there was a term for it. If it twists.
A torsion, yeah.
It could cause a torsion. So it could actually twist and stop blood flow or whatever to your ovaries.
Okay.
So if that happens, it's very painful for one, I read, and you would need to go in for emergency surgery and get your ovary removed.
Well, no. So the torsion, because as the ovary, because the cyst is encompassing the ovary, and usually when it's like 5 centimeters or larger, you increase that risk. And so a twist of the ovary would be a sudden onset of pain. Like people are like, at 3:46, I just doubled over in pain. Sometimes it can like intermittently twist, like untwist on its own, or it stays twisted. You end up in the ER. They would do an ultrasound and they're looking at blood flow to the ovary. And if it's twisted, the recommendation is to do a surgery to untwist it, take out the ovary or take out the cyst, and hopefully the blood flow goes back to the ovary, because we'd like you to keep your ovary, especially in young girls when this happens. We don't want to take out ovaries because that would affect fertility. But we're hoping that the blood flow will resume. So as long as you haven't waited long enough. Similarly, in men, like torsion of the testicle would be a similar medical emergency that you want to get it untwisted as soon as possible.
Yeah. So I guess the plan is to monitor, like come back in 2 months, because it could either one go in its own, or it could either stay the same or grow. If it gets any bigger, then we talk about a surgery.
Yeah. Do you want to kind of remove the cyst?
I guess my question is, what if once they find it, why not do anything about it right then and there, so that I'm not living this life of not doing nothing, not doing cartwheels or jumping on a trampoline or having rough sex.
Prioritize.
I think when we do ultrasound, sometimes, I'm glad you mentioned like you had eggs, which are follicles. And oftentimes people will see the word cyst, and there could be a simple cyst that's very small, which could just be part of the normal physiological function of the ovary. So people don't realize, just as they don't realize they have another hole to pee, people don't realize that ovarian cysts happen with the menstrual cycle. So every month your brain sends signals to your ovaries, and one follicle, one egg gets the signal to be like, I'm going to be the one to like release and ovulate, and maybe I'll meet a sperm. And so
in my case, no.
That is a cyst is forming. It ruptures. The egg is released. And then there's still a cyst that remains within the ovary that if you're pregnant, that cyst will produce progesterone to maintain a pregnancy for the first trimester. So cysts are normal. They come and go. It's those cysts that persist that we worry about, and size that we worry about. And then there's cysts that might be with blood in them that take time to resolve. There can be the endometriomas, which are part of endometriosis. Solid cysts that we worry about, precancer, cancer, that we might act sooner on. So the fact that she's waiting to see if it resolves on its own means that there's like a lower level of concern for like cancer.
Understood. Got it.
So you said something. So this is, I'm going to ask the, like, I don't know, there's a second pee hole or whatever.
Question.
So when you're done with menstruation, I always thought that just means because you ran out of eggs. Are you like, so now do I have no more eggs, or my body just no longer releases eggs? Like there could be some follicles, I guess, in the ovaries, and they're just, or
well, the ovaries, the number will decline with age. I mean, you still have your ovaries, but you're not having any stimulation of them because your hormones are not being stimulated.
But it doesn't mean there couldn't have been, like, I don't know. I just remember learning as a kid that women is born with a certain number of eggs.
Yes.
And so I always thought that menopause meant you gave all your eggs away, you're done.
Well, yeah. So you're not having any more. Yeah. It would be hard even to stimulate. Like, could like a reproductive endocrinologist, a fertility doctor, take someone at 50 who's still menstruating and try to like stimulate through IVF, but likely the quality of those eggs is bad, that they wouldn't result in a pregnancy. So they'll recommend like an egg donor in that patient. And so as you go through menopause, your estrogen levels will decline, and your estrogen is made from your hormones up in your brain, stimulate the ovary. And now your estrogen levels decline. So you're not having any stimulation of follicles. Yeah.
And for the younger crowd, that are experiencing like really debilitating periods, painful, why is it that it's different for each person? Does genetics have anything to do with it? Just pain tolerance, all of the above?
It can be. It can be all of the above. There might be some genetic component to it. People have different pain tolerances as well. And then the other thing with pain, like when young girls come in, we are asking again about like diet habits, sleep, stress, are they sexually active? Is there infection risk? And then, any sexual assault, psychological components, because some people will have chronic pelvic pain. And so we want to do a thorough investigation, but we're usually involving our gynecologists. If they're young, they're pediatricians, gastrointestinal doctors, and then sometimes our psychologists or psychiatrists.
And so I've heard of younger patients or, women now are having more and more cysts. So what do you do to, obviously you don't want to take out like the ovary because, in case they still want to have kids later on in life. What do you do when that happens, when they constantly just keep getting like cysts and all that stuff?
So when people have the ovarian cysts, which are most likely going to be stimulated by the hormonal changes with the menstrual cycle, one way to perhaps prevent it would be to quiet the ovaries in a sense. And so using birth control pills would be a method, because birth control pills they work by making you not ovulate. And so hence that's how it's used as contraception. And one of the benefits of the birth control pill for non-contraceptive benefits would be lighter periods, less bleeding. You can manipulate your period so you don't have a period. So people are always like shocked by that. And moms are always saying that's not healthy to skip a period. It cleans you out, because that's how they were taught. But if you're manipulating your period, then it's okay not to have it.
So is a hormone, it's basically not stimulating your uterus to expand then, if you're going to try to skip your period? Is that what you're doing with the...
So the pill will work by not stimulating. It keeps the hormones at a steady state. So the ovaries are not getting stimulated. Okay. That one follicle is not stimulated to ovulate. So the lining of your uterus isn't getting stimulated to grow. And the only reason you have a period on the birth control pill is because there's that last week of the placebo pill. So then it's like suddenly your hormones, you're not getting hormones. So that's like a switch, and then it sheds that lining. So when the pill was first introduced, they made it a 28-day pack because women had monthly cycles. Again, a man made the birth control pill. So, but now we would just say you don't need to have a period. And so you can take them back to back, or using like an IUD would be another way, the hormonal IUDs, to not have a period, because it works by thinning the lining of the uterus, the hormone in the IUD. But most people may still ovulate with the IUD. So we'll tell them that. And so it won't help maybe like the crampiness, or it may not help. Well, no, the IUDs will help with the cramping, but it may not help with the emotional aspects of the hormonal swings. And sometimes a Mirena IUD, do you have a Mirena IUD?
I have a Mirena.
Can make ovarian cysts like stay around a little bit longer.
Another thing that I've been hearing a lot about that I never heard of when I was younger, maybe it's a new thing, is PCOS.
Oh, okay.
Like
yes.
what exactly is, because I've had a couple nieces that have had it and, they were trying to have kids and it was hard because of the PCOS.
So PCOS is polycystic ovarian syndrome, and it is very common. And there's, a little bit different criteria of diagnosing it in like adolescence, but usually you're not going to be diagnosing it until they've been a few years past their first menstrual period, because those first few years, the menstrual cycle is going to be irregular. But PCOS, typically I tell patients there's 3 criteria and you have to meet 2 out of the 3 criteria. So it's having irregular periods, the ultrasound findings of PCOS, which would be either your ovary is enlarged, depending on the volume. We look at the volume, or you have the classic multiple follicles in the ovary. It may be what we call like a string of pearls. So you look at the ultrasound findings, and on the edge of the ovary are all these little cysts that look like a string of pearls. So you're looking at that. And then also elevated androgens, testosterone, which might mean increased acne and hair growth. Not like abnormal hair growth in the sense that it might be on your face, your chest, your abdomen. But it can get tricky because some ethnicities just have more hair growth. So you have to ask, like, what do your moms and aunts look like? What's typical for your ethnicity? And so people will come in and we'll kind of figure out, do they have PCOS? And it is important to know, because we know that PCOS can impact not only fertility later on, but also increased metabolic syndrome, diabetes, cardiovascular disease risk. So we're trying to kind of like optimize all aspects of their health. And typically people are overweight with PCOS, but there can be like skinny PCOS. So weight loss may be recommended. And we also will check for insulin resistance. So someone could have the basic testing of diabetes and their doctor's like, no, you're fine, you don't have diabetes. But if you dive a little deeper and kind of test for their insulin resistance, they would likely benefit from using medications to help their insulin work better.
Oh, yeah, interesting.
Well,
So, yeah.
yeah, no, I'm taking it all in because I'm actually
my world.
I'm taking it all in just because, as we mentioned, I just hit a milestone birthday, and there is stuff that I'm feeling that I'm like, I'm like, oh my God, and I'm thinking it's normal, and now I'm thinking like, okay, maybe it is normal, but I guess the other thing too is we've advanced in technology that maybe there's things that can help me through it. Yeah. So like one, for example, is I generally am always cold. Now, I swear to God, I'm like, open the window. Like I'm like, it's so, I have sweats and I'm hot and I'm like, what is wrong with me? Yes. And I actually mentioned it to my mom and she's like, oh, she goes, that happened to me too. Go see your doctor. They'll give you something. She goes, I forget what it's called, but it'll help you with that. And I'm like, oh, okay. So like, I'm thinking to myself, like, again, living with things, right? Yes. I'm like, oh, okay, but it's not like that. It happens here and there and you just live with it.
Well, you don't have to.
But that's my point. I'm like listening to you. I'm like, you know what? I really don't have to live like this. You know, like you just, the thing is like, I have insurance. You know, it's the only thing that's stopping me is me because I'm telling myself like, you know, like, it's okay. I can live with it. But I'm listening to you and I'm like, I don't have to live with this kind of stuff.
Yeah. Well, if you're in the perimenopause, and some people will think, okay, I'll go a whole year without a period. Now I'm menopausal. Everything should get better in a sense. And we would say, well, those symptoms can persist after menopause. Like hot flashes can persist for years after menopause. and then also being in a menopause state when your estrogen levels are lower, that does have impact on your body and your bone health. So there is, a reason that we're seeing this upswing in menopausal hormonal therapy because it's beneficial on multiple aspects. Yeah. So you need to make an appointment. This is your birthday gift to yourself.
This is, I'm like, and I think that's I don't know. I think I'm just like one of the normal women that just say, just live with it. It's normal. And yeah, it's not that dire. Cause like for me, I don't go to the doctor unless I really have to.
I think that's something that we as moms do, right? So like if our kids, if there's like, when they're little, right? Every little symptom, we like, oh, gotta take them to the doctor, and we wouldn't say that's normal. We might call the advice nurse first to find out, sure. But like, I find myself as like, something's not feeling right with me. I'm like, whatever. But if it was my kid, I'm like, oh gosh, I have to call the doctor to find out if this is okay.
Yes.
So we should treat ourselves the way we treat our children. If we feel something's not right, then call the advice nurse, find out, do we have to go in to see the doctor or not? I mean, I just take my own advice, but I just like sort of had that little.
It's very true.
Proactive.
Yeah. So the hot flashes for sure. And then the second thing for me is when I get my period, it's so heavy now.
Yeah.
Yes.
Like it's extremely heavy where I will leak, and I've never had that before. And it just, what you said resonated with, if it's impacting your life, you should go in and see. And then for me, like now when I sleep and I'm on my period, I actually have to sleep with a towel.
Oh, you need an appointment ASAP.
And I'm like, oh my God,
but people do. They carry change of clothes.
Yes.
And I have to be like, that's not normal.
And that's what I'm hearing right now is, because I'm adjusting my life because of this nuance, right? And I'm just thinking like, that's part of me just being older. Yeah. But to your point, it could mean nothing. It could mean something, but just get checked.
Yeah. I mean, along with the symptoms, the classic symptoms of like hot flashes and night sweats, perimenopause encompasses so many things. I mean, I think people have poor sleep because of the night sweats, irritability, anxiety, depression, dry skin, like joint pain. They've been, studies showing increased frozen shoulder. So all of these things, when you actually, when you look it up, it's I have a poster in my office and I'm like, I show patients and I'm like, why did I hang this up? It's such a depressing poster. But I have it there to say, if you're having these symptoms, and we'll talk about it, and I'll say, here's what we can do. And oftentimes people are like, I'm okay, I'll live with it. And I'm like, all right, but when you're ready, I'm here for you. So to come in. Yeah.
Yeah.
Marita, as a teacher, do you see a lot of students struggling with this in the classroom?
I think there's still a stigma about talking about it in general in public. So when girls come up to me and like they're like asking to go to the bathroom, and I'm like they'll have to they feel like they have to explain to me. I'm like, I teach mostly juniors and seniors. So I'm like, you should not have to ask me to go to the bathroom. I have a policy, but they'll go, I have to go to the bathroom at my period, or like, it's really an emergency. I'm like, fine, go. I can think about one student who, not this year, but in the last couple of years, that was like, yeah, I'm sorry I missed. I just had really bad periods. I'm like, well, I'm sorry that it happens to you. So, but it's not really talked about. I maybe because the class I teach, that they don't, the girls don't come talk to me about that. Maybe like Dawn Marie's class, I bet you the girls come talk to her because they actually talk about sexual health, reproductive health and stuff like that. I think it's great that our schools still in all public schools, right, in public restrooms, they provide access to menstruation products. So
Dr. Bovone, just from your opinion, do you think that we're doing enough from an educational standpoint for our girls, like in school, or do you think there's a lot more to do or that we can do to educate? Because like a lot of these things,
you don't tell people that there's a different pee hole.
We do have they do have classes, right?
Yeah.
But I mean, is that enough? Or is because unless you are in a family that talks about this, or you have friends, you just don't talk about it, right?
Right. We don't have a Dr. Bovone with us.
Well, I have a daughter who doesn't want to talk to me about it. So I encouraged her when she first started, keep track on this app. So that way you'll know, what sanitary products she wants. She doesn't want to talk. She doesn't want to talk to me about it at all. Probably because she knows I talk about it a lot. But I think some of it is, because I'll see a lot of teens who get referred from their pediatrician, and they'll come in with their moms. And I usually have the mom in the visit, until the end. I always kick out mom and I explain about confidentiality. And a lot of time, every now and then we go through, heavy periods or irregular, they're missing school, they're missing sports, and we'll go through our different options of treatment. And by the time they see me, they've probably tried the non-inflammatory medications like Motrin, Aleve. We might have to bump up their dose or try a different, more prescription medication. But every now and then I get a mom when we start like the birth control talk of like, using birth control pills to maybe alleviate their symptoms. Sometimes moms hear that and they're like, well, no, I don't want her on the pill. You're telling her it's okay to have sex. And I'm like, yes, it is okay to have sex. And she will have sex one day when she's ready. But like, there was one mom in particular where her daughter told her story, how she's missing school, how it's affecting her. And I had to point out to the mom, because she didn't want her to be on the pill, like, look at your daughter, look at how it's affecting her life. This is what's happening to her. And I think, the mom was able to pause and really realize it's not about her decision, it's her daughter's decision. And I always will also tell with the teen visits, I say, you are always welcome to come here. We talk about confidentiality, but I say some of your friends may not have parents who are going to bring them to the doctor, males and females. And so Planned Parenthood is available for anyone to go through. And so I'll point out sometimes you're bringing your daughter in to see me. If you don't let her make decisions, she'll go to Planned Parenthood, which is great and fine. But like, how good to support your child in coming, to a physician, which Planned Parenthood has physicians as well, but just supporting their medical decision-making and teaching them to take charge of their own health. Because again, when they become teenagers and going off to college, I'll say your mom can't call and ask all these questions. Like, I want to talk to you. So I try to like push them into adulthood of like making decisions for themselves and reaching out to me.
Yeah.
All right. Thank you so much. Do you guys have any other questions?
I'm good.
Yeah, I think we'll pause and you can call the doctor.
I know.
Yeah,
I need
go
to
to the doctor.
I know. I need to schedule. Well, that's another thing. I have my primary care doctor, but it's been like the longest time since I've actually seen an OBGYN doctor. Yeah. And maybe that's because I take my regular PAPs.
Yes.
But I haven't had a real reason to go to an OBGYN. Yeah. So
some primary care physicians are interested in menopausal health. So that would be like one question to say, do you do menopausal health? And if the answer is no, then seeking out, do they refer you to a gynecologist? The North American Menopause Society will have people who are listed who are interested in menopausal health. You can also there's MIDI Health, Genevieve, like online menopausal health that you can access. And which is fine. They can take your history, prescribe hormones if you need it. Obviously, if you needed an exam, then you're going to be needing to see either primary care or gynecologist, but no excuses.
No, I will schedule that appointment.
Yeah. My OBGYN is great. She's not delivering babies anymore, but she's still doing like, the other stuff. But she just told me that she's going to school to get certified for menopausal health, which is perfect for me because I'm going to that. So if you want a recommendation, she's great. And I think you know her too.
I don't know.
Yeah,
perhaps
we'll talk about it.
Yeah.
Well, thank you
guys.
Maria,
Thanks for having me.